This recording is Chapter 6, Part 2 of 2, Bone Tissue and the Skeletal System. Osteogenesis imperfecta is also known as brittle bone disease. This is an inherited genetic disorder that occurs when there's a problem producing the protein collagen. You'll remember that collagen is the most abundant protein in the human body. There are actually different kinds of collagen, and you don't have to know what type of collagen is responsible for the different variations of osteogenesis imperfecta. However, when collagen is not produced properly, what happens is the bones can't form properly. Collagen is a major component of the matrix of bone. And not only do bones not form properly, but they're also going to be very fragile and they break easily. Collagen is responsible for keeping bones strong, whereas the minerals in the matrix of bone make it hard. So we end up with brittle, hard bones that have no strength. With osteogenesis imperfecta, this leads to bones that fracture easily and frequently, and that also leads to deformities. We often see people with osteogenesis imperfecta being short in stature, and their bones tend to bow out. You can see the bowing or bending of the tibia, which is the weight-bearing bone, on this upper picture on the right-hand side. It can also affect the curvature of the spine, and due to the lack of collagen forming properly, it can affect the skin, it can cause the joints to be loose, muscles are going to be very weak, teeth tend to be very brittle, the sclera, the white of the eye, will turn blue, as you can see in the top upper right picture on this screen, and it can also affect hearing. There is no cure for osteogenesis imperfecta. When bone breaks or fractures, the fracture may often be classified by different characteristics of that fracture. Oftentimes, doctors will look at the fact that the bone is either fractured and non-displaced or fractured and displaced. You can see a displacement fracture in the middle on the bottom. There's a lot of displacement going on in that particular fracture in the shaft of the humerus. If we look at whether or not the bone has broken all the way through or just partially through part of the bone, then we call that complete versus incomplete. And then we also can call bones either simple or compound, or closed or open, respectively, according to whether or not they've actually punctured the integrity of the skin. Something that's gone through the integrity of the skin is referred to as an open or compound fracture, which you can see at the bottom right picture. If it's broken but the skin remains intact, then we call that a closed or simple fracture. There are other ways to describe fractures. We can describe them by the appearance of the fracture. So if it goes through horizontally in regards to the shaft of the bone, we refer to that as a transverse fracture. If the mechanism of injury is a twisting mechanism that causes the bone to fracture in a spiral manner, we call that a spiral fracture. If the bone appears as if it's been smashed into itty pieces with a hammer, that is referred to as a comminuted fracture. If the bone gets jammed into itself, that is known as an impacted or impaction fracture. With younger children, because their bones are more flexible, sometimes part of the bone will break. So we'll have a partial fracture on one side, and then the cortex on the opposite side will buckle. That is known as a green stick fracture. And if a bone fractures at an angle, that is known as an oblique fracture. So if the bones are fractured and they can be set back into their original place because it's not that bad of a fracture, say there's just a little bit of displacement, but the surgeon can actually take his hands, or doctor can take his hands and realign it, that is referred to as a closed reduction. A reduction is simply putting things closer together and reducing the space between them that's been created when an injury has occurred. So if a fracture requires surgery to put things back where they belong, that is referred to as an open reduction. Fractures are sometimes named according to the doctor that first saw them and decided to describe them. And a common fracture occurs with individuals when they fall on a hand that's outstretched. It's very common when people fall to stick out a hand to break their fall. And when a person falls with an outstretched hand, he can either break his wrist, break his elbow, or break his shoulder. Usually the wrist is most common. Or a dislocation of the wrist could occur potentially, a dislocation of the elbow, or a dislocation of the shoulder. Those are the three possible joints that would be affected if a person's falling and puts his wrist out to break his fall, or puts his hand out to break his fall. So if a person puts his hand out to break his fall, and that causes a fracture of the distal radius, and that fracture causes posterior displacement, which we can see in the upper right hand picture. Remember, the back of the hand is posterior. So if there's posterior displacement of the distal radius, which you can also see on the upper X-ray, that is referred to as a Colle's fracture. So Colle's fracture is a fracture of the distal radius with posterior displacement of the fractured piece. When a bone fractures, treatment often begins with reduction, which is the realignment of the broken bone ends. When a bone breaks, the blood vessels in the bone and in the periosteum, and sometimes in the surrounding soft tissues, are going to allow blood to seep into the area. And as the blood clots, it forms a mass known as a fracture hematoma. Soon those bone cells in the injured area, deprived of nutrition and fresh oxygen, begin to die, and the tissue at that site becomes very swollen, painful, and inflamed. Within approximately 2 days, new blood vessels grow into that fracture hematoma. Fibroblasts and chondroblasts invade that fracture site from the nearby periosteum and endosteum. The fibroblasts produce collagen fibers that span the break and connect the broken bone ends. Chondroblasts secrete cartilaginous matrix that bulges out externally and later calcifies, forming what is referred to as a fibrocartilaginous callus that spans the break and connects the broken bone ends. This entire mass of repair tissue, also referred to sometimes as a soft callus, is going to splint the broken bone together. Within this mass of repair tissue that has formed, osteoblasts begin forming spongy bone. Within a week, osteoblasts begin to lay down the trabeculae of new bone around and within the fibrocartilaginous callus. These trabeculae span the width of the callus and unite the two fragments of broken bone. Gradually, the fibrocartilaginous callus is replaced by immature bone, converting it into a bony or hard callus. Bony callus formation continues until a firm union forms between the two ends, which takes about 2 months. beginning the formation of the bony callus and continuing for several months afterward. The bony callus is remodeled. Excess material on the diaphysis exterior and within the medullary cavity is removed. Compact bone is laid down to rebuild the walls of the shaft of the bone, and the repaired area resembles the original unbroken region because it responds to the same set of mechanical forces. And that is how bone repair occurs. There is a law that states that stress on bone builds bone, and that is known as Wolff's Law. So Wolff's Law says that bone will grow and become bigger when stress is applied. So when people work out, they're actually helping to build their bones. People who exercise regularly have thicker, denser bones. The pull of muscles as well as the force of gravity for weight-bearing activities is going to help increase bone density. High-impact intermittent strains are best to enact Wolff's Law, and mechanical stress works by increasing the deposition of mineral salt, which makes bone hard. Remember, bone stores calcium and phosphorus in a molecule known as hydroxyapatite. That's how we store calcium in bone. It's not just calcium alone, it's calcium and phosphorus as hydroxyapatite. And so this increase in mineral salt as well as production of collagen fibers occurs with exercise and stress on our bones. In order for bones to develop, grow, and repair, they need the proper nutrition. Calcium and vitamin D are needed to form calcium phosphate and calcium carbonate. Remember that our bones mostly store calcium in the form of hydroxyapatite, which is a combination of calcium and phosphorus. Because we can't make calcium, we have to get it from dietary sources. Calcium can't be absorbed by our intestines without active vitamin D. And active vitamin D is formed from a cholesterol precursor model. Sunlight will trigger our body to make vitamin D, and we can also eat vitamin D in either food or supplements. And as vitamin D is either absorbed by our intestines or produced by our skin, that vitamin D will travel to the liver. And once vitamin D gets to the liver, it turns into a hormone called calcidiol, which is the primary form of vitamin D circulating in our bloodstream. Then from the liver to the kidneys, in the kidneys, the vitamin D, the calcidiol, will be further transformed into calcitriol. And it's the calcitriol that is the biologically active form of vitamin D that will help us absorb calcium in the intestines, as well as resorb it from the kidneys and also help build bone tissue. So the active form of vitamin D, which is calcitriol, does three things. It helps us absorb calcium in the intestines, it helps us resorb calcium so it doesn't get peed out after urine is formed by the kidneys, and it helps to build bone tissue. There are other important nutrients involved in building bones. Vitamin K is important in supporting mineralization of bone. Magnesium helps to support bone health by stabilizing and strengthening it. Omega-3 fatty acids are important because they help reduce inflammation that can interfere with osteoblasts laying down bone matrix called osteoid. And again, it's the vitamin D that stimulates the absorption of calcium and phosphate. Hormones play a critical role in bone tissue. Growth hormone is produced and secreted by the pituitary gland. And one of the roles it has is to trigger the proliferation of chondrocytes at the epiphyseal plate, which will increase the length of the bone. Growth hormone also helps calcium retention, which will enhance mineralization in the bone, and stimulates the activity of osteoblasts, which are going to lay down osteoid matrix, improving the density of bone. The thyroid gland secretes a hormone called thyroxine, which promotes the activity of osteoblasts, as well as promoting the synthesis of bone matrix. Gonads will produce estrogen and testosterone. Estrogen is produced by ovaries, testosterone is produced by testes, and these sex hormones promote osteoblast activity as well as the synthesis of bone matrix. This is what causes a growth spurt during adolescence. They also promote the epiphyseal plate to close, ending longitudinal growth. And what normally happens is estrogen has a much more rapid effect, which is why girls shoot up faster than boys when they're hitting puberty. But because it has a faster effect, not only do they shoot up first, but their epiphyseal plates close sooner. Whereas the boys, they'll shoot up a little bit later in terms of their longitudinal growth, but it takes longer for their epiphyseal plates to close, so they end up being taller. Osteoporosis is a condition of porous bone. You can see the difference in the upper right-hand picture on this slide between normal bone and osteoporotic bone. And what happens is with osteoporosis, there's a decrease in bone mass, which means there's a reduction in the thickness of compact bone, as well as a decrease in the number and the size of the trabeculae in spongy bone. And what happens with osteoporosis, remember, our bones will remodel. We remodel 3 to 10%, depending on the text that you read, of bone mass every year. So some of it is resorbed and then new bone is laid down. When the rate of resorption exceeds the rate of formation, that's when the condition of osteoporosis is seen. Sometimes osteoporosis occurs if a person's body part is immobilized. If somebody breaks his wrist and it's in a cast and there's not any movement to put stress on bones, osteoporosis can be seen in those bones in as short a time as 3 weeks. And it takes 30 to 50% loss of bone mass before it even shows up on an x-ray. So imagine losing 30 to 50% of bone mass within 3 weeks just because of immobilization. That's why when people are injured, they really try to get them moving much more quickly. So osteoporosis is more common as people get older and become more sedentary because they're not putting stress on their bones, and they're also not able to get nutrition in as well as they normally would. Their intestines aren't absorbing nutrients, and sometimes their diet becomes bland and without nutritional value. So proper weight bearing, exercise, adequate nutrition often helps reduce the risk of osteoporosis. In women, it tends to be more common after menopause because estrogen is a hormone that inhibits osteoclastic activity. Blasts build, clasts break down. When a woman is in childbearing production years, she has a higher level of estrogen. When she goes through menopause, that level of estrogen decreases dramatically, and the osteoclasts are no longer inhibited. So that often means that the rate of resorption exceeds the rate of bone formation. Osteoporosis is most commonly seen in the proximal femur, the vertebrae in the wrists, because we have bones that have a lot of spongy bone inside them. Some of the treatments for osteoporosis include things like bisphosphonates, calcitonin, and estrogen. Calcitonin is a hormone that actually helps put calcium back into bone. Let's take a closer look at calcitonin first. It's on the bottom of this slide. Calcitonin is a hormone that is produced by the parafollicular cells of the thyroid gland, also known as C cells. And when blood calcium levels are above 11 milligrams per deciliter, the parafollicular cells secrete calcitonin, which inhibits osteoclasts while stimulating osteoblasts. This will allow for calcium to be deposited into bone. Calcitonin also decreases the rate of absorption of calcium in the intestines and causes the kidneys to allow calcium ion loss. Now, if blood levels of calcium fall below 8.5 milligrams per deciliter, in other words, if we don't have enough calcium circulating in our bloodstream, then there are 4 little parathyroid glands just posterior to the thyroid gland that are going to release a hormone called parathyroid hormone or parathormone. Parathormone is going to stimulate osteoclasts to break down bone matrix, and that releases calcium and phosphorus into the bloodstream. Parathyroid hormone will stimulate calcium resorption in the kidneys and the small intestines, and it also helps to stimulate the synthesis of vitamin D. Now, parathyroid hormone will break bone down even if bone is already weak or osteoporotic. It doesn't matter what the condition of the bone is. So it's really important to maintain strong, healthy bones at all times. Here we have a really good chart on bone homeostasis. Now, the values that they're giving here, 10 milligrams per deciliter, remember, I'm not worried that you're going to memorize numerical values for calcium levels or phosphorus levels. It's just a good illustration of how when we have increased calcium levels, you see the red arrow pointing to the thyroid gland releasing calcitonin, osteoclast activity being inhibited, and calcium resorption in the kidneys decreasing so that the kidneys get rid of calcium and calcium levels in the blood decreasing. That is negative feedback. So we have increased calcium levels on one side going to decrease on the other. That's working in opposite directions. That's negative feedback. Now let's look on the left side on the bottom where we have a decreased calcium level. The parathyroid glands are going to release parathyroid hormone or parathormone that stimulates osteoclasts to break down bone, releasing calcium and phosphorus from the bone. Calcium is going to be resorbed by the kidneys because the parathyroid hormone will work on the kidneys saying, hey, we got to keep the calcium. And calcium will also be better absorbed by the small intestines via the increase in vitamin D synthesis that helps to raise blood calcium levels back to where they need to be. So why is it so important for us to maintain a certain level of calcium in the bloodstream? Well, without it, muscles don't contract properly, nerves don't function properly. Where's a big muscle in your body that's super important for it to contract on a regular basis? The heart. So what about the brain functioning? These are super important organs to be able to function properly in order for a person to survive. Hypocalcemia, abnormally low levels of calcium, can occur if there's an improper diet or hormonal imbalance. There are things that happen with hypocalcemia, including convulsions, arrhythmia where the heart doesn't beat properly, tetany where a muscle is locked into position, spasms, stridor. All these different things can occur. It can affect coagulation of blood, and bones can become brittle if there's not enough calcium. So there's a special sign called Schwastik sign where if you tap on a certain area of the face, it'll go into an abnormal contraction or twitching, and that's one of the signs of hypocalcemia. Hypercalcemia, again, if there's too much or too little, it's going to be a bad thing either way. So hypercalcemia is going to cause disruption in nerve function. So the nerves are just going to be super excitable. That can lead to fatigue, lethargy, weakness, anorexia, nausea, constipation, kidney stones from increased calcium salts. The heart can't beat properly, so it's going to start beating very slowly and can even be blocked at sometimes. So again, if it's too much or too little, it's a bad thing. That's why homeostasis allows our bodies, when they're functioning normally, to maintain levels of calcium in our bloodstream at a very specific range so that things don't go bonkers. So this is the end of part 2 of chapter 6, and we're going to move on to chapter 7. Have a great day.